In a locked drawer in a museum in Naples sits a set of surgical tools that could, with only a little updating, still be recognized on a modern operating tray. Scalpels, forceps, clamps, even a working speculum, essentially unchanged in basic design for the better part of 2,000 years. This was not medicine as folk superstition, leeches, and prayer. This was, in real cases, functional, deliberate, evidence-informed surgery. This is the story of the Roman surgical toolkit, a piece of ancient technology so advanced it unsettled the archaeologists who first understood what they were looking at. The single richest source we have comes from Pompeii, the city buried and perfectly preserved by the eruption of Mount Vesuvius in 79 AD. In one home, now known as the House of the Surgeon, archaeologists found dozens of bronze medical instruments, still laid out roughly as they had been used, frozen in place by ash. Scalpels with replaceable steel blades set into reusable bronze handles, bone forceps, called volsella, for gripping and removing tissue, hooks, probes, and needles for suturing wounds closed. And, most startling to modern viewers, a bronze vaginal speculum, using a screw mechanism to widen and hold itself open, a basic design that gynecological specula still use today. This was not improvisation. These were purpose-built standardized instruments, made by craftsmen who specialized in medical tools, and used widely enough across the empire that near-identical sets have been found at sites hundreds of miles apart. We're not guessing about how these tools were used either. A Roman writer named Aulus Cornelius Celsus, writing in the 1st century AD, produced an extensive medical text called the Medicina. It describes, in careful and often quite graphic detail, procedures including the removal of bladder stones, the treatment of hernias, the setting of fractures, and even a form of cataract surgery. The cataract procedure, called couching, used a fine needle inserted into the eye to push the clouded lens out of the line of sight. It did not cure blindness in the modern sense, but it could genuinely restore usable vision in some patients. Roman surgeons also understood the danger of infection in a practical, if not fully scientific sense. Celsus describes cleaning wounds, and Roman medical writing repeatedly emphasizes using clean instruments and clean water during procedures. They did not know about germs. That understanding was still nearly 2,000 years away. But they had clearly observed, through repeated practical experience, that cleaner conditions led to better outcomes. Pain management existed too, though it was far cruder than modern anesthesia. Opium poppy extract and mandrake root were both used to sedate patients before painful procedures, with wildly inconsistent dosing and real risk of overdose. Perhaps the most advanced medical system in the Roman world existed in the army. Roman military hospitals, called valetudinaria, were built at permanent legionary bases, with wards, drainage systems, and dedicated medical staff. Roman military surgeons treated an enormous volume of traumatic injury, arrow wounds, sword cuts, crushing injuries, which in a strange way gave them more hands-on trauma experience than most surgeons would see again until the era of modern warfare. They developed effective techniques for tying off blood vessels to control bleeding, called ligature, a technique that would later be lost in parts of medieval Europe and painstakingly rediscovered centuries afterward. That loss is worth sitting with. This was not a smooth, continuous march of medical progress from Rome to today. After the fall of the Western Empire, a great deal of this practical surgical knowledge simply stopped being taught and practiced at the same level. For long stretches of the medieval period in parts of Europe, surgery regressed toward the crude and superstitious, performed by barbers and untrained practitioners, rather than the specialized, literate physicians the Roman world had produced. It is important not to overstate the comparison, though. Roman surgery had no anesthesia in the modern sense, no antiseptics, no understanding of blood types, and mortality from even minor procedures could be devastatingly high by today's standards. What is genuinely remarkable is not that Roman medicine matched ours. It is how much of the basic instrument design, tool shapes, still fundamentally recognizable today, they arrived at through pure hands-on trial, error, and careful observation. Which raises a genuinely open question. How many Roman surgeons died? Or how many patients suffered? Refining a screw mechanism speculum or a bronze bladder stone extractor into its final functional form, with no textbooks and no formal science of anatomy to guide them. We do not have Roman patient records the way modern hospitals keep charts, so we cannot answer that with real numbers. It remains one of the quieter, harder to see costs behind these gleaming museum instruments. Today, that same toolkit sits behind museum glass in Naples, a set of bronze instruments that a modern surgeon, given a moment's translation of purpose, would recognize almost instantly. Ancient Rome is remembered for its roads, its armies, and its buildings. Its medicine deserves a place in that list too, uncomfortable and unglamorous as the details can be. Would you have trusted a Roman surgeon with a knife? Let us know in the comments. Subscribe, because next time we are looking at a blade so sharp and so strong that modern metallurgists needed electron microscopes just to explain how ancient smiths in India managed to make it at all.